Hey there, I'm back. Happy Halloween. This is take 2 of our live apothecary wisdom because we were filming and then there was no sound. And now here we are again. Taking a deep breath and celebrating Halloween. And can you see our Halloween costume? Can you guess what I'm dressed as? I've got my medicine pouch, I got my knife, I got my gauntlets. Any guesses? Put them in the box. Well, I'm dressed as an apothecary, or really not an apothecary. I'm as an herbal protector, as an herbalist. Yes. So this has been an interesting morning. I filmed a bunch of videos about fever, and they all have been deleted with no sound. And here we are trying it again. So my name is Maria Chaudhary. I'm a midwife and an herbalist, and we're here today standing in the apothecary on Halloween talking about something incredibly important and incredibly scary for some people, and that's fever. We're going to talk today a lot about fevers. We're going to talk about what is a fever. We're going to talk about what causes fevers, how your bodies respond to fevers, symptoms of fevers, how to treat fevers, with hydrotherapy, how to treat fevers with herbs and with our products. So before I dive in, I want to make sure, is everyone here? Is anyone listening? Is there sound? If you can hear me, give me a thumbs up. Well, while you're thumbs upping, I'm going to have a sip. Okay, I'm going to take that as a yes because I'm standing in front of the camera and Heaven's behind the camera and I got a thumbs up. So, Heaven, what are you dressed up as?
I'm a bat.
You're a bat. Cute and black with little ears.
And wings.
And wings, yeah. Oh, nice. And what are you guys dressed up as? Put it in the box. Put it in the comments. And also, while you're putting in the comments, think about, does anybody here sick right now? Does anybody have sick children? And does anybody have a fever right now? Or questions about a fever? Now's a good time to put that in the box. Let's talk about fever, okay? So let's start from the top. What is a fever? A fever essentially is just an elevated body temperature. There are types of fevers. There are 3 types of fevers. There are adaptive fevers, there's pyrogenic fevers, and there's artificial fevers. So adaptive fevers, they come from overworking, exercising really hard, getting really hot, from your hormones. So throughout your menstrual cycle, there's times your temperature elevates, right? Or when you just give birth and your milk is coming in, you start to have a fever, right? Or a toddler that's teething, they start to have fevers. Those are all adaptive fevers. They're not from a pathogen. They're not sick, right? But then you have these pyrogenic fevers. And that always makes me think of, if you're in my generation, as soon as you hear the word pyrogenic, you think of that song, Pyromania. Yeah? No, Heaven doesn't even know that. Doesn't even know that song. Oh my gosh. Anyways, so pyrogenic fevers are fevers that come from your body protecting itself from illnesses, from viruses, from bacteria, from fungus. And then you have artificial fevers. Artificial fevers are like getting in a hot tub, a sauna, a spa, a sweat lodge. Those are artificial, right? There's something outside of you that's happening. So what happens in your body when you have a fever? How does this whole fever process work? I'm going to talk about broad reach for the fever and how it works in the body. This is for a pyrogenic fever. So a pyrogenic, meaning a pathogen, a bacteria, a virus enters your system. And then our immune system greets it and meets it and sees what it is, right? And sees that it's a foreign invader. So all of a sudden it starts to produce a bunch of white blood cells and a bunch of phagocytes. And these white blood cells multiply, and they send a signal to the hypothalamus in your brain. The hypothalamus is what controls your body's temperature. And then the hypothalamus sees, oh, there's an invader, so I'm going to turn up the heat. And it turns up the heat, turns up the heat, turns up the heat, turns up the heat. Because these bacteria, viruses, funguses, parasites, they can't live in hot climates, hot temperatures. So your immune system is working in two ways right now. It's really brilliant. So it turns up the heat, and so the heat starts to weaken and destroy the pathogen, but then directly the white blood cells start to attack it, and then the phagocytes start to eat it, and then it goes through the circulatory system down into your kidneys, and then we eliminate it in our waste, in our urine, in our bowel movements, and in our sweat. So the immune system is responding and is trying to create homeostasis. The fever is merely a symptom of an illness. It is not the illness. Most of the time, the fever is your friend. We sometimes hear the word fever and we almost overreact as our society, as our culture, and we want to like cool it down right away or go get antibiotics because we don't quite fully understand how much the fever is actually protecting us. I want to talk a little bit more about what's causing this fever, and especially because it's Halloween. On Halloween, it's totally perfect to talk about this because people used to think that fevers were like they were possessed by something, an evil spirit. Somebody put a hex on them, or they're sinners and they're being punished by God for their misdoings. I'm taking this stuff off because I want you to take me seriously because this is important. Or in our modern culture, we say, oh, we caught a cold. And I don't think either one of those things are real. I definitely don't think you're possessed, and I don't think you're being punished by God because you have a fever. What I think is happening is your immune system got weakened. Why did your immune system get weakened? It was weakened because a whole list of things. Maybe you're depleted. Maybe you lack vitamins and minerals and you're just malnourished and you're dehydrated. Maybe you just gave birth and you bled quite a bit and you're anemic. Maybe you are stressed to the max and so you're not sleeping, so that means you're not eating well and you're eating a lot of sugar, and that weakened your immune system. Because the truth is we're bombarded by viruses, bacteria, pathogens every minute of every day, but we're not constantly sick. We only get sick when our immune system weakens. Another reason that we could maybe get sick from something is like we visit a place that we've never been, right? And so our immune system isn't prepared for this new environment. But since we're not constantly sick, we have this healthy immune system, and then when our immune system gets suppressed, then we allow this pathogen in, and that whole immune response starts to happen. So what are the symptoms of a fever? I'm going to go through this list here because there's a long list, and it's a little bit important for you to know the symptoms. And I really want to know, before I get into the symptoms actually, I really want to talk about back more to the cause of this fever. So if we're talking about a pyrogenic fever, we're saying it's coming from an illness. So what is causing this illness other than our immune system is down? There's some infection somewhere, right? So let's find out where it is, and then we can figure out how to treat it better. So either you are sick or you're taking care of someone that's sick. But either way, you have to start at the top and work your way down the body and get all these questions answered. Then you'll know what to do. So start at the top. Okay, headaches. Have you had any headaches? How does your head feel? Now look in the eyes. Are their eyes, is there mucus and crusty? Is it red? Are they inflamed? Are they having discharge? What about in their ears? Are they having earaches, pain in their ears, inflammation, ringing in their ears? In their nose, is there a sinus infection? Is there nasal congestion? What about their throat? Is their throat sore, hot, tight, scratchy? What about Their ability to breathe. Can they take deep breaths? Are their lungs clear? Is there tightness, chest tightness? What about abdomen? Is there pain in your abdomen? What about in your back? Does your back hurt? Or does it burn, itch, sting when you go to the bathroom? Is there blood in your urine? What about digestive issues? Is there constipation? Is there diarrhea? What about, are there injuries anywhere? Did you fall down? Did you break something? Hear something crack, pop? Or do you have a cut anywhere? Is there a bruise somewhere? What about a surgery? Have you just had a surgery? Those are the most likely portals for infection. And once you start to understand the portal for infection, then you can start to address the fever, right? Let's go into the symptoms of a fever. Okay, there's a long list of symptoms. Essentially, I just want to remind you before I go into the symptoms, because these all seem like problems, right? But I want to remind you that a fever is your body's attempt to create homeostasis, to create balance and health in your body. And there are mild fevers and moderate fevers and really high fevers. There are simple fevers that we can just take care of at home that need no treatment. And there's some that warrant going to seek medical attention. Okay, so the first one's chills, goosebumps, pain, headache, backache, body ache. What else is on the list? Just having a hard time concentrating, being tired, lethargic, delirious, having like really stressful dreams, insomnia, having a really rapid pulse where the pulse, your heart is trying to work hard and trying to work fast, and so your respirations are challenged. But then you have a loss of appetite, and your breath, foul smelling breath, and your tongue has a white coat on it. And your skin could be really hot and dry, or it can be cool and moist. You can have explosive diarrhea, or you can be really constipated. Those are the primary. Oh, the other one that's really important is a sign of dehydration, and that is scant urine that's dark, and then you don't urinate very much. Those are the most common thing, but another thing that happens, it doesn't happen very often, and fortunately most of the time they're not serious, but they are always startling, are febrile seizures. So like I said, that you can have a fever that ranges from mild to complicated, right? You can have a febrile seizure that's simple or complicated. Fortunately, most of them don't require medical treatment beyond observation. But what happens is, and they're not sure why this happens, but this primarily happens with children from 6 months to 5 years of age. And they get really tight, they seize up, and they lose consciousness. And it usually lasts less than 15 minutes. They usually only have one, and when they come to, they're a little bit disoriented and maybe achy or weak, and they're also like confused, and they may or may not remember what just happened to them. And those can happen. Those can be a part of a fever, so they need to be a part of the conversation. But then they can become more complicated and more complex by having multiple of these, and those definitely you want to rule out and see what's happening there. So we've talked about what a fever is. We've talked about what causes a fever, how to identify where the fever is coming from. We've talked about the symptoms. Let's start to talk about treatments. Okay. Are y'all still with me here? Little heart, little thumbs up, nothing going on. I'm doing all this, and great. Let's have it sit. This is good because we want to talk about the general treatments. Okay. General treatments are, of course, rest. You want to rest. Either you're in the room or your patient or your loved one is in the room, and there should be good air ventilation, but there should not be a draft. There shouldn't be direct air blowing on them, bundling them up. they need to drink a lot. They need to drink a lot for multiple reasons. One, dehydration is one of the biggest problems with the fever. Not so much the fever, but it's the dehydration. So, giving them frequent sips. Let's talk about that. There's a lot to say about that. So you want to give them frequent sips that either can be cool water to kind of cool them down, or hot tea to help them keep them warm, so they keep this, because we talked about how elevating the temperature is what kills the bacteria. So you kind of can keep them a little bit warm with some hot tea. Also, what I want to say is the more they drink, the better circulation they have, and the more water goes through their system, goes to their kidneys, and then is released in their urine, and so they're releasing the toxins. So you need this flow to happen. So you need to have this regular urination to release all the toxins. When, in terms of eating, we always talk about starving a fever. You want to starve a fever because it's everything shuts down. It's hard for the body to absorb and utilize all the nutrients anyways. So you want to feed, so you don't really starve them, you just eat minimally. So you soups, fresh vegetables, fresh fruit. You want to avoid things like dairy products, grains, sugar, meats, and fatty proteins. You want to avoid those. And then even after the fever is over, when the fever is over, you have to remember a fever, once again, creates homeostasis in the body. And so sometimes people feel better after a fever. And so that's a good time to come back to your diet, and starting with vegetables and fruits, and then slowly, gradually working in and adding the grains and the proteins. Not just jumping right into pizza after a fever. Bad idea. The other thing that's important is about supplements. When you have a fever, you don't need to take your iron and your zinc. It doesn't assimilate. But if you want to take supplements, probiotics are a great idea, and vitamin C is a great idea. And then honestly, just letting the fever run its course, unless or until the fever gets to 102 degrees Fahrenheit. By me saying that sentence makes me realize I didn't define the temperatures of a fever yet. Let me do that. So a normal body temperature is 98 to 99 degrees Fahrenheit. A fever would be 99 degrees to 102 degrees Fahrenheit for an adult, and 99 degrees to 103 degrees for a child. And now for a newborn that's less than 6 weeks old, 100.4 is considered a fever, and that warrants seeking medical attention. 100.4. So let's come back to when to treat a fever. We talked about how the heating up the body is a good thing. And so until the fever either gets beyond 102 degrees, in both an adult or a child, or the symptoms become so uncomfortable, that's when you would start to treat the fever and to get the person more comfortable or to break the fever. Okay, so there are a few ways we can do that. One is through hydrotherapy, and then another one is through herbs. Let's talk about hydrotherapy first. So I have this book, Home Remedies. This is the best book. And you see that. This truly is the best book that I have on treating fevers, and I've done a lot of these techniques with my family. So I'm referencing this. And what I'm talking about probably would be better for you to receive the information if you had diagrams and if you had a list. But I'm going to be really visual and take my time and explain things. Okay? Hydrotherapy, a benefit of hydrotherapy is you want to alternate hot and cold. We want the core of your body is hot, and we want to bring the heat from the core of your body to the surface and on the skin, and the skin is when it can sweat and it can cool off. The body can cool off, but we also want to keep your brain cool. So the first one is to put the person in a hot bath. Before you put them in the bath, check their temperature orally. You can check rectally, but check your temperature orally. Don't do the axillary. Do it orally. Be sure of what the temperature is. This is like an art here, so there's not an exact one thing to say or do, but what I want to say with all these steps I'm about to tell you is you need to be well prepared ahead of time. You need to have all the towels, you need to have the bathroom warm, you need to have the cool water ready, you need to have their clothes ready, their dry bedding and everything all prepared before you do this. Okay, so the first one is called a hot bath. Complicated, I know. So put the person in the bath. If the bath does not cover their entire body, put extra towels in the bathtub to cover their legs or to cover their chest. We want to elevate their temperature. Actually, we're trying to take their temperature up. So, like when their temperature is like anywhere between 99 and 101, but they're having a lot of pain and aches and stuff, this would be appropriate, right? So we want to get their temperature to that spot between 102 and 104. So we want to increase their temperature. At the same time, we have the hot on their core, but then we have cool cloth on their face, cool cloth on the front of their neck, cool cloth on the back of their neck, and they're drinking not icy water, but they're drinking cool water. So this is where the timing comes in. You don't drink cool water and then check their temperature. So you want to be accurate on their temperature. And once you get them elevated their temperature between 102 and 104 and they start to sweat, keep them in that place and they're sweating, and then you'll feel like, okay, it's time to get out now. So if you can keep them in that place for just a little while, it'll be good because you want that sweat to happen. Then when it's time to get them out, not cold water, but cool water. You have a pail, you have a bucket, you have a way to put cool water. Rinse them off with cool water. It's going to be very cold for them, but it's cool water. And then you're going to dry brush their skin. You're going to rub their skin, 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 rub their skin. And then you're going to dry them off completely. And then you're going to put them in like flannel clothes or natural fibers, and then put them straight to bed without any drafts. And then you're going to give them a lot of water. Right? So that's one. Questions about that?
We have 2 people joining us.
All right. So let's do number 2. Number 2 is like a steam cabinet or a hot foot bath. So maybe you don't have a bathtub, right? So you get a hot basin, a basin filled with hot water. And then you put the person's feet in it. So they're naked. So you need a towel under their seat. You need a towel. You need a sheet around them. You need a blanket around them. You need a cool cloth for their face, a cool cloth for the back of their neck, for the top of their head, cool water. Once again, same thing. You want to check their temperature. You want to raise their temperature to be between 102 and 104. You want them to sweat it out. Keep them hydrated the whole time. Okay, when you're taking care of a person with a fever, they can't really help you that much. They're really lethargic. The person taking care of them, must be in charge. You have to watch them, be kind, but control them, make sure they drink, tell them when they're done, dry them when they're done, put them to bed when they're done. So you be the one in charge. So same thing, you got to cool them off so you're not in a bathtub, so you don't have a pail of water, but you have a cool sponge. Cool sponge them off, and then dry, rub them, rub them, rub them. Rub them, rub them, rub them, dry them off really well, put them to bed. The third thing, because I've done this before, is called hot fomentations. And I've done all of those, but this one takes a little bit of work too, but it's not impossible. The person is going to be lying down. A hot fomentation is a hot, wet compress. So what you do is I got a shower curtain and I laid it down on the bed. Or you know what else works really well when I was teaching this in my building your herbal apothecary class, we use trash bags. So you get a big trash bag and cover the area of the bed so you don't get it wet. You get a hot, wet compress. So your biggest cooking pot, the pot that you want to make, you can your vegetables in. You need 2 towels. One, you're going to bring it out and you're going to lay it down, and then the patient is going to lay down on their back. So it's going to cover their back. The next one you're going to wring out and you're going to lay it on their chest. Then you have a cool cloth for their face, for their neck, for the back of their neck. They have cool water. If you want to, when they're laying down, they can have their knees bent and you can put their feet in hot water, or you don't have to do that. I didn't do that part. You could wrap a hot towel on their feet that way and keep them warm that way. They need a towel and a blanket over the top of them. This is really good when they have a fever and they have lots of lung congestion. Once again, once you're done, you have to make sure they're hydrated. You sponge them off, sponge them off, and then you dry them off, you brush them off, you dry them off, you put them to bed. Another alternative is to do an apple cider vinegar bath. And I talk about that in the Herbs for Kids course. So if you want to learn about that, download the Herbs for Kids course, the ebook and the course, and you'll learn all about the apple cider vinegar bath. What else do I want to say? Before I go into the herbs, I do want to say something else about this. There is a contraindication for this treatment that I just gave you. If you have a person that you know has a heart condition and they have heart attacks, heart condition, any heart related that you know about it, but you don't know that much about it, don't do this. It's too hot, it's too much for them. Don't do these treatments on a person that you know has a heart condition. Another thing is don't give them an ice bath. Ice baths are reserved for really high fevers. They're like 105 degrees, and by that time you should have already taken them to a care provider, somebody else that knows a little bit more than you do, so ice baths are the next level of care. And also don't rub them down with rubbing alcohol. Don't do that, pretty please. That's all I want to say. Oh, well, one other thing I wanted to say about hydrotherapy is you can do that with just water. Or when I do it, of course, see, I'm an herbalist, so I didn't do it with just water. I make my baths with herbs. So I have the children's cold and flu bath. Heaven's going to show that to you. And that is filled and blended with herbs that are great for reducing a fever, reducing pain, and clearing lung congestion and nasal congestion. So all the things that come along with cold and flu and fever and lungs. So cold and flu bath would be a great hot bath to put them in, or it's a great compress to lay on their chest, or it's even a great steam cabinet to make and foot bath. In another video, I'm going to be talking more about coughs and lung congestion, but we also have another bath that we can use, and that's called Children's Healing Herb Bath. And so that's really great for children. Both of these baths are great for people of all ages. Okay, I'm going to have a sip because we're about to talk about the herbs and the herbal actions and how to treat fevers with herbs. So when we think about fevers and symptoms and humans, we want to think about the whole person, the whole plant, the whole being, the whole big picture. We're not just trying to mask the symptoms and bring the fever down. If we were to do that, just take ibuprofen, right? Or take acetaminophen, which I don't think you should do, but just do that. Or if you're trying to help support the immune system, get rid of the pathogen, feel more comfortable, and be a little bit more in harmony with what's happening, then look to herbs. That's where your help is. The herbs, the category, you don't just have one type of herb to help with a fever. There are like several of them that help with fevers. So the primary category would be called a febrifuge. A febrifuge just simply means it reduces a fever, reduces body temperature. Then you have a classification of herbs called diaphoretics. Diaphoretics, that means they promote perspiration, right? So they help you sweat. That helps release the toxins. It helps cool your body, your skin. There's another type of herbs, that are improve and aid in circulation. Another group of herbs that are important are diuretics. They help improve in circulation, but they also help nourish and feed and tonify and strengthen your kidneys, and so that you have healthy urination and healthy release of the toxins. Another classification of herbs are nervines, because you have so much tension and you're in a lot of pain and you can't sleep really well. So you need to relax and feel better. And then another group of herbs are called anti-microbials. Fortunately for us, herbs are like wise and intelligent and fully capable, and they do a lot of things. So all these herbs on my list do most of these, fit in most of the categories I just talked about. I want to talk a little bit about antimicrobials before I start to go into this list. So we have these things, in our world that are life-saving. They're called antibiotics. They're life-saving, potent, powerful medications, and in the right context, they're the absolute best choice. Not all fevers and not all sicknesses are the right context, right? There are herbs that have antibiotic property, but they're not truly antibiotics. Here's why. Antibiotic means no life, kill life. Antibio, no life. Instead, they're more antimicrobial, because an antibiotic goes into your system and definitely kills the pathogen, the bacteria, and your immune system and your beneficial bacteria. It doesn't strengthen or support your immune system. It just kills everything. Whereas an antimicrobial certain ones can go in, like garlic is a perfect example, can go in and kill and destroy a pathogen, a bacteria. At the same time, it helps strengthen and supports your immune system. It doesn't damage your immune system. So an antimicrobial works with your body rather than destroying everything in it. So when we call these herbs antibiotic herbs, there is some truth to that, but that's not the whole picture of it. So I want to call them antimicrobial herbs. I think it's a more accurate word. So a long list of herbs off the top of my head that are good for fevers. We've talked about a lot of them, and there are videos associated with most of these herbs on this list, and if there's not videos yet, there will be. So check them out. So first one, peppermint, lemon balm, chamomile, catnip. What else do we have? Elderflower, elderberry, yarrow, thyme, hyssop, garlic, ginger. I'm going to check my list. Did I miss one? I got them. So those are wonderful herbs, safe for children, safe for elderly, safe for all of us, and most of them are incredibly relaxing, and they're fever reducing, and many of them, such as thyme, yarrow, echinacea, garlic, those are all antimicrobial, elderberry. And so they're a more complete approach and a holistic approach to this. And I don't want to call the fever a problem, but it is a problem because you're having to miss work and you're taking care of someone and someone's uncomfortable and it's taking time and you need help. And so it's a more holistic approach to helping you help someone else feel better. I want to talk a little bit more about yarrow, and in other videos I'm going to talk more about thyme. And I want to talk about how our products can help you with a fever. And so I'm going to run through that. Before I go into the products, I'm going to tell you one little story about Yarrow. Okay, I'm going to have to make lots of videos about Yarrow because I deeply respect and honor Yarrow as a plant because it is my primary medicine teacher. It's the one that showed me that just because you think you know one thing about a plant doesn't mean you know the plant. And it has taught me that in very humbling ways. So by me honoring Yarrow now almost gives me a little of like, ooh, what's around the corner? What next lesson am I about to learn? Because they're always pretty potent, right? I met Yarrow in Alaska. I just turned 21. I just came out of a Zen monastery. I had cut my hair really short. I lived in Alaska and I had hitchhiked quite a ways. Whole story in Alaska, right? And I didn't have any money and I needed to get home, and I went to Alaska, and I was a silly girl and I needed a job, and I went into the HR office, and the HR woman was like, I'm like, look, I need a job, serious, like something fierce. I'm a great worker. What do you want me to do? I can do anything. And she's like, okay, so what do you want to do? And I was like, and I gave her my honest answer. My honest answer was, well, honestly, I just want to meditate all day. And this woman was awesome. She's like uptight, kind of desk lady, you know, the type of person, admin person. And she was awesome though. She kind of looked and tilted her head. Oh, I know what job you can do. You can work in the laundry. And I'm like, laundry? She's like, you'll love it. You want to meditate all day? Laundry. I'm like, okay. So I go into this all white room, pretty clean laundry, and my job was to fold sheets or to fold towels. And you get into a rhythm. It's just like counting 1, 2, 3, 4, 1, 2, 3, 4. Or you have a partner and you synchronize with the partner and you fold sheets and towels, right? For hours and hours and hours. It was awesome. I truly meditated all day and night because I worked through the night because I needed to earn some money. Anyways, it's right at the change of the seasons, right when Aurora Borealis is coming out. It's right when it's like starting to be cold now. And everyone out there, they're all young and, well, they're not all young, but no one's really taking care of themselves, right? They're out there partying and working late nights, and they're really not taking that great care of themselves. Needless to say, everyone starts dropping like flies, getting sick. They're just getting sick, and we all sleep in a dormitory, pretty much. And then we work together, and we sleep in a dormitory, we eat in a cafeteria, we're constantly around each other. And I wish I could remember this girl's name, but she was my partner for a while. We folded sheets together. I can't remember her name, but she's the one that taught me about Yarrow. And so we're walking through the cafeteria, and we walk by, and she reaches down, and she's like, oh, here's some Yarrow. And she plucks the Yarrow. And, oh, here's one for me. Oh, here's one for you. And she gets me one, and I have one. And we go in, and then we get one of those plastic, like Pepsi cups, those big cups. And then she puts the plant upside down, the flower upside down, and then gets the hot water from the coffee maker and puts it in there. And she's like, it's super bitter. I don't care. Just drink this. Drink a cup of this like all day. Just don't stop drinking this. I'm like, okay. She's like, I promise you'll feel good. And I'm like, whoa, I don't know, man. But okay, I'll do it. I'm game. Let's see what happens. Needless to say, like I said, the story, everyone gets really sick. Her and I, and it's just a few other people, are the last ones standing. We didn't get sick, right? And so we ended up working the night shift, and we ended up, for me it was really good because I didn't have any money, so I earned enough money to like get myself out of there because it was time, the season was over. So I learned from that, okay, wow, Yarrow is great at preventing colds and flus. Everybody else is peeking their guts out and they all have fevers and I don't. And there's no reason I shouldn't have it, right? So I learned that. And then in another video, when we talk about postpartum and we talk about pregnancy and we'll talk about birth and we talk about Yarrow in a whole different way, you will see that I didn't really know that much about Yarrow. And I had a very intense dark night of the soul because I recommended someone to drink Yarrow for a reason that wasn't appropriate. And I'll tell you that story next time. You're going to have to listen for what that one is. But Yarrow taught me how to keep myself healthy and how to prevent colds and flus. And so that's where I'm going to talk to you. That's why I'm going to share Yarrow with you. So Yarrow is great for that, but it's also a great wound healer. So we talked about it. Fevers can come from wounds, so it would be a little bit appropriate to go into that conversation, but I really want to save that. But wounds can come from like cuts. Yarrow is really good for cuts. It's also called a styptic or an antiseptic. It's antiseptic, but it's a styptic and astringent, and so it's really drying. So if you have bleeding or pussy or oozy or just wet, oozy pus, that gross, just Yarrow really helps dry it up and helps prevent infection, and it's really good at that area that's been traumatized. That area is in pain, so it's a good analgesic for pain. Yarrow is an analgesic, and they say it's good for headaches, and since I was preparing for this talk, I read a little bit about Yarrow. So back in the day, this is a kind of like related to Halloween too. Back in the day, they used to say, oh, Yarrow is good for headaches. So what you do is you take a stick of Yarrow and you shove it up your nose and you make yourself bleed, and then that'll help the headache, maybe take the pressure off. And then you take the leaves of the Yarrow and you shove it back up your nose, and then it'll stop the bleeding. That's not what I recommend that you do. You could try that if you want, but that's not the recommendation. What I'm trying to say is Yarrow is a febrifuge, it's a diaphoretic, it's an anti-microbial, and it's an analgesic. So when you're trying to reduce a fever, you're trying to combat a pathogen, and you're trying to feel better, Yarrow is for you. So we have Yarrow in Children's Immune Boost, which is of our products, Children's Immune Boost is probably my favorite for fevers. Just straight up fevers. Now, if this is a child, before I go further, Children's Immune Boost, you don't have to be a child to take these things. It's all in dosages. For a child, you take 1 drop per 5 pounds. For an adult, you would just take a dropper as often as needed. The one thing I want to say about Children's Immune Boost is it is not intended for everyone. It is not intended for women who are pregnant. So if you're pregnant, don't take Children's Immune Boost. Take all the other things to help you. Now, if they have a cold, I'm going to just run through these quickly because we'll talk about these next week too. But if they have a cough and a fever, then Children's Respiratory Support. Children's Respiratory Support has thyme in it and elderberry. Thyme is in both of these products. So the herb bath, it's a diaphoretic, anti-microbial, really helps them, like all the ways I just described, hydrotherapy. Also, we have Immune Tea. Immune Tea is with chamomile and peppermint and elderberry and echinacea. It's a wonderful, sweet, delicious tasting tea, great for pregnancy, great for children. And then I have this other thing here that I wasn't gonna really talk about, but it came to me last night, because some of you that are listening, you might be listening to me because you're a breastfeeding mom, right? And I have this product. I'm not intending it to be for fevers. However, nursing nectar is made with chamomile. It's made with catnip. It's made with fenugreek, and fenugreek helps with circulation. And it's made with lavender, so that's nervines. Chamomile and catnip are top on the list for helping with a fever. So if you are a breastfeeding mom and you don't want to take a bunch of things, but you need something to help you, then you can keep drinking your nursing nectar tea. Or if you had a fever from mastitis, you can keep drinking your nursing nectar tea. So that was kind of like a little spontaneous, like, oh yeah, it does that too. And then the last product I want to talk about, and we'll talk about it more, is just that fevers hurt so bad. And the flu hurts so bad, it's called bone break fever. That's why they call it the flu, the bone break fever. It hurts so bad. And chamomile and catnip, once again, to save the day, that's in our children's tranquility. So when the child is fussy, they are hurting, they have a fever, either from teething or a fever from an upset stomach, like a stomach GI, diarrhea, constipation, irritation, or a fever from a cold and flu, Children's Tranquility is another supportive herbal remedy that can help them. Wow, I've kind of gone through a lot. I'm going to double check my notes and make sure I didn't skip something. One thing I want to say about in terms of treating fevers, one thing to not do, please don't give your child aspirin. It can create this syndrome. It's called Ray's syndrome. I don't know that much about it, but every book says to not do that. So I'm going to repeat, and do not do that. Also remember that this is all just information, educational, here from me to help you. And why did I even do this in the first place, right? Why did I do this in the first place? Because I had a son who was in a perpetual cycle of being sick. He was sick all the time. Like, he would have a cold, and then he'd have a fever, then he'd have an earache, and then he'd have congestion. It was just constant. Once I realized how to remove the juice box, and then I started really studying about herbs, I ended up writing a book called Herbs for Kids, making that course, creating and developing these herbal products. They came from my child being sick. All of Birth Song Botanicals came directly from my life, right? And so I encourage you to take the time, because the other thing I really want to talk about, I didn't say one more thing that's actually really important, is when to seek medical attention and medical advice, right? I encourage you to become your own inner expert, to observe your child, even if this is your first baby and you're brand new at being a parent, right? You still know the subtleties of your baby. You still recognize when they're more clingy or when they're more whiny or when they're... You still know there's something up. And when is a good time to seek medical attention? There's no cut and dry answer for this. In my course, I give really clear parameters, so I encourage you to download the course and download the book. I just want to say that sometimes we get fixated on a few things and we want to make our decision based on one piece of information rather than all of the information. So for example, when we're cultivating our caretaking skills, they're just not innate. There's no one expecting us to just know exactly what to do all the time, right? That's why we look things up, and we have groups and friends to help us, and we have books and we have herbs, and no one knows it all, right? So when you don't know what to do, you reach out and you look for help. But then you start to learn to trust yourself, because you've done that again and again and again, right? You start to build like experience. And with that experience, you cultivate these skills, and these skills help you make decisions. There's no, like I said, there's no one-size-fits-all answer, but here's a scenario I want you to consider. Here's a child that has a fever, we're just going to say 104 degrees. Well, that's hot. But they're walking around, they're drinking well, they're going to the bathroom, they've eaten a little bit. They don't have explosive diarrhea. They don't have rashes. They're not coughing. Other than the temperature, they seem fairly fine. That's one scenario versus another one that has a fever of 101 per se. We know that 101 isn't time to go seek medical care, right? But 101, yet that child is lethargic, they're not eating, they're really dehydrated, they haven't gone to the bathroom, they have all these other symptoms of other illnesses. So when we just look at the temperature, that temperature didn't tell us if we should go seek medical care or not. It's the whole picture is what helps you decide that. The other thing is, if in doubt, the saying is, if in doubt, check it out. There's no harm, there's no foul, because what's the big deal if you go to the doctor? I mean, they're smart. They're trained for this. What if you go to the doctor and they say, oh, guess what? I'm really glad you're here, but that's a virus and you're just going to have to ride it out. As much as that might be like, darn, I missed a day of work. That versus, inside you think, should I go? No, I don't know. Should I go? Oh, I don't know. Should I go? And then later you don't go, and you don't go, and you don't go, and you don't go. And then later it unfolds and becomes a much bigger problem. And that, like, inside you, that guilt inside you, that, damn, I knew better. I should have gone. I should have trusted that. I didn't trust myself. Damn. That takes a long time to get over. So if you're just in doubt, just go call, check it out, talk to someone, take them to the doctor. I want to say that. And then I also want to say that, reminding you that fevers can escalate and can be a part of something really big, or they can be really common and really everyday, and they don't have to be a big deal. And drinking your teas, taking your baths, having your tinctures, eating light, bundling up, writing it out, that's oftentimes some of your best medicine. If you are going to stay home or you're treating anyone, you should always write down your story. Write down when you first notice the symptoms. Write down everything you give your child, the dosage, the amount, the time. Write down what happened, like what result happened, and then set a time frame. Okay, so these herbs, and I'm arbitrarily making this up. In 4 hours, let's say it's Thursday. It's Thursday evening, and if in the morning, by Friday morning, if he's not better, I set that time frame to decide, because Friday morning you have to decide if you're going to get to the doctor in time for the weekend, right? So set a time. Okay, Friday morning. And so then when Friday morning comes, you reevaluate your plan, you reevaluate what you've been doing. You see if you need to continue with what you're doing or if you need to deviate from your plan, and then go to the doctor. Also, the other time to go to the doctor is if what you've been doing isn't working anymore. That's another good time to go to the doctor. So I cover all this stuff in more detail in Herbs for Kids ebook and course. So I encourage you to go there, download that. You can download it at birthsongbotanicals.com. It's under the children's section. I encourage you to stock up on your products, because it never happens when you're ready. It never happens at a convenient time. And to drive across town or to get something from somewhere else is a real bummer when your child's sick or when you're sick. So stock up now. I encourage you to, I'm not totally finished, because as soon as I say drink deep, she's going to turn this video off, so I'm just holding off. If you're watching these videos anywhere else other than on our blog, I want you to go to our blog right away, because I have a bunch of blog posts about treating fevers naturally. I have a lot more there. And now I can encourage you to drink deep and always walk in beauty.